Dr. Kevin Kavanagh is a retired physician, also founder of a national organization called Health Watch USA. He is heard here at 7:40 on Mondays, at 7:20 on Wednesdays, and at 9:30, just after the 9:30 news on Fridays. Dr. K, as he is affectionately known. Good morning, sir.
Good morning, Jack.
Let me say something here, because we're not as rushed for time as we are the other two times you're on with us, and that is, just so everybody knows, Dr. Kevin Kavanagh is receiving 0 for his appearances on this show. He does it out of the goodness of his heart, just like every other guest that we have on here. Whether you agree with him or not, there's no conspiracy involved. He's just a man of science and happens to go with science. And I just want to take this opportunity, Kevin, to thank you for the many hours that you have spent during these last 6 months for us. It really means a lot, and you've done a great job.
Well, thank you, Jack. I tried to bring up different points of view and try to get the science out there, at least on how we're analyzing the articles, and sort things out for people.
Well, we appreciate you very much, and it's a tremendous commitment on your part, and we very much appreciate it. Now, we start with some really what you call very good news.
Yes, the vaccine, as you know, is still out in the future, but a bridge to the vaccine may be much closer, and that's Eli Lilly coming up with their monoclonal antibody serum. It's gone through phase 3 testing, or is in the midst of phase 3 testing, and their initial results show a 72% reduction in hospitalizations and ER visits. And so that's really good news. But there are some caveats here. And these are interesting for a couple of reasons. One is the caveats are the same as the convalescent serum. This is the group of patients that get this drug immediately after diagnosis, or within 3 days. And they have to have just mild to moderate COVID-19. So very similar to the restrictions on convalescent serum. The other thing is that this drug, because it's manufactured in the lab, will theoretically have a lot more product available. And this was the problem with convalescent serum. If you could remember what I said when convalescent serum was being dissed so much in the media, that, well, it's really not that bad, but it's not that good either, because you can't get enough product out of convalescent serum. So this overcomes that problem. Now, it probably won't be available to everybody that has a diagnosis of COVID-19, but for those people that are very high risk, such as being obese or being elderly like myself, it's good news, because if you do come down with it, you have now a commodity that may well decrease symptoms. And the other thing that's very interesting with this is how all of this is being played out in the media. Convalescent serum, as you know, has been dissed repeatedly in the news media because of the misstatements of the director. They said they overstepped his bounds, etc., etc. But then you've got a product that is essentially the same product, only you can get more of it coming out, and none of that negativity is out there. It's just a great product. Well, you know, it's really the same product. So like I said with convalescent serum, I don't think it's necessarily a tremendous game changer, but it certainly did need emergency approval by the FDA. This product is even better, and I mentioned that before, because you can get more of it, and that makes it more of a game changer. So that, I think, is very good. And of course, the vaccines are still off in the distance, but Pfizer has announced, along with BioNTech, their German partner, that they will probably have initial data out and maybe asking for approval the end of October. Again, the public's going to hear conspiracy theories. It's terrible. It's Trump's vaccine, on and on and on. Well, it's not Trump's vaccine. This is a vaccine from Pfizer in Germany. The FDA is going to go through an approval process. Their hearing is on October 22nd, Vaccine Advisory Committee. You can listen to it online. Get the data yourself. And with so many of the political talking points that we're hearing in this country, we're not the only country in this. Look what's going on in other countries and what they're saying. And because this vaccine has a partner in Germany, You can look at the German approval process. You can look at the process of the European Union. You can get your sources from many different areas and many different people and opinions so that you don't have to just rely on a single source. So that's what I suggest people do. Both of these announcements are very good. The one caveat on the vaccine is it probably will not be available for the general public until the mid or latter part of next year.
Whoa, that contradicts what the president's saying.
Well, a little bit. I mean, I think they're, as far as initially available or not available, here's the thing. When it's initially available, you won't have a large amount of safety data, but you'll have enough that if you're really high risk, such as elderly or you're a frontline worker, you'll probably want to get the vaccine. If you're low risk, guess what? It probably is not going to be available. All these vaccines require 2 doses. And by next year, there'll be a lot more safety data to help people make decisions. So this, I think, is pretty good news.
And Kevin, I've got a rather long text here, but I want to read it all. It says, I'm confused. I just listened to the 9 o'clock news and heard a soundbite of Joe Biden saying that all the deaths in the United States were caused by President Trump. Well, you and I both know that, that's an overstatement, that's not true.
Yeah.
If he had required everyone to wear a mask and socially distance, we wouldn't have had the deaths that we have. However, 30 seconds later, I heard a story about the state Supreme Court is hearing arguments that Governor Beshear doesn't have the constitutional authority to mandate people wear masks and social distance. Help, I'm confused. That's from Elmo. So how do you answer Elmo? That's a good question, really.
Well, it is, and it's a legal question. And believe me, during this time of politics, we're all going to get confused because the primary concern of people on both sides is to get elected. It's not to sit back and reasonably go through the science. And I hope I don't get inundated by numerous complaints over that, but you've got to be very careful. And I also think you need to look at the difference between state authority and federal authority. So I don't believe the federal government can mandate wearing a mask, but they can set an example. Now, it may be that there's a legal avenue for them to do that. I mean, I'm not a lawyer, but certainly messaging that you have to wear a mask, that is really going to help, is an important message. I wouldn't put all my eggs in the vaccine basket. There's 2 reasons. One is to get herd immunity. This virus is going to have to infect at least 60, 70, probably 80% of the people because it is highly infectious. And the vaccine is unlikely with its first iteration to be 100% effective. It may only be 50 to 60%, 70% effective. And then with the anti-vax movement and people scared to take vaccines, you're going to not have good compliance. So you're not going to get a critical mass of people immune just to the vaccine. And of course, you'll have some people that come immune naturally through getting infected in the community. But the problem with that is we don't know how long immunity lasts. This is a coronavirus. People that are asymptomatic carriers may not be a little more protected than if they actually didn't have the virus in the first place. And we need to kind of sit back and say we all have to do everything we can to stop this virus. So I think it's going to take wearing masks also. That's going to be very important.
All right, let's go to your calls. Jim, good morning. Thanks for holding.
Hi, guys. Dr. Kavanagh, I heard where Biden said that he blames all the death in America and the coronavirus on Trump. And I'm not saying this to be smart. I'm just asking you, do you think if Jesus was the president, he could have stopped the coronavirus?
Well, that gets into a philosophical kind of a discussion. There are some leaders that think that the coronavirus is coming after mankind because of the way we've abused the earth, and it's the earth protecting itself. So who knows? But I do have faith in science, and I think that science could stop the coronavirus, similar to how they've stopped many pandemics and epidemics in the past. And so I think we need to put our faith in some of our leaders that have been dealing with these epidemics for many, many years. Remember, the leaders of the CDC, this isn't their first rodeo. They have dealt with pandemics for a long period of time. They're going by experience, what has been done in the past. So I think that we need to put our faith in our scientific leaders. We'll have to wait to probably after the election until we get a little bit more clear messaging.
Well, now I don't want to end on a negative note, but we're just about going to have to, and that is, if you will, for the next 3 minutes, the study in CDC Journal on aerosolized virus living for 16 hours.
Well, and that's very much a concern. And Jack, to put this really in a nutshell, this is what we've been talking about for a long time now. I think the show's been ahead of the game. The data has been showing aerosolization is a real probability. That's why if you wear a mask, especially a cloth mask, you still need a social distance. This explains, I think, the increased morbidity and mortality we're seeing in nursing homes, and also cautionary notes on opening up schools. We need to pay attention to airflow, air filtration. We need to social distance in schools, have masks, and do pool testing. Extremely important. When we open up schools, we need to do so safely. We just can't bury our heads in the sand and say, we're going to open up and go back to the way things were before.
All right. Now, deaths in nursing homes, you have some information about that.
Well, there is. That is a huge area that most people are dying in, unfortunately. In Kentucky, 57% of the deaths are in nursing homes, but only, let's say, 11% of people greater than age 80 will die of COVID-19. So what's the difference? The difference is the facility. Again, cramped, no masks, or it's hard to get nursing home residents to wear masks, hard to get them to social distance, and they have oftentimes poor airflow and air quality. Unfortunately, that's the same scenario which we're finding in our schools. We need to take lessons from nursing homes, unhealthy buildings, and we need to make our schools safe.
How about CDC procedures, data on the dangers of eating in restaurants? We don't want to make it even worse than it's already been on these restaurateurs, but tell us what you know about that. We just have a little over a minute.
Well, yeah, the restaurants I'm concerned about. I've always been concerned about indoor dining. Again, this goes with the aerosolization, the idea of having good airflow, good air quality. Restaurants really need to look at that, and they need to shift to outdoor dining. And of course, I've said repeatedly, I think that it would be good to have state and federal grants to help restaurants restructure and do that so we can eat safely. But they can be very successful with strategies of pickup or takeout. And you can see the Seafood Lady, which actually opened during the pandemic. This was in Lexington. They've reported excellent results with doing their Gulf Coast menus and having their items taken out. And so we need to live safely. We need to have ways that restaurants can open, but open safely. We can't go back to the way things were before.
30 seconds. We're just about out of time. Give us your last thoughts before this weekend.
Well, it's all up to you. Wearing masks, social distancing can snuff out the flu, and it can even snuff out COVID-19. And we need to do that in addition to everything else. We have a lot of additional resources at healthwatchusa.org. Just click on the large coronavirus up at top, and it'll take you to our resource center. Thank you.
Dr. Kevin Kavanagh. Thank you, Doctor. We'll talk to you Monday.